to Take Your Medicine. On today's show, I will be discussing one of the most widely used drugs that we use to treat type 2 diabetes. Today, I will talk to you about metformin. Metformin is used to help control high blood glucose levels in type 2 diabetes. It works by helping to restore your body's proper response to the insulin you naturally produce. It also decreases the amount of sugar that your liver makes and that your stomach and intestines absorb. It is also used to treat conditions such as polycystic ovary syndrome, gestational diabetes, which is diabetes experienced during pregnancy, and also helping to prevent type 2 diabetes in patients tested and found to be insulin resistant. Controlling high blood sugar levels helps to prevent kidney damage, blindness, nerve problems, loss of limbs, and sexual dysfunction. Proper control of diabetes may also lessen the risk of having a stroke or heart attack. Many patients ask me, when's the best time to take metformin? Should it be taken before or after meals? My advice to them is to take it just after they have eaten, as after you eat is when your blood sugar levels rise the most. So keeping this increase to within normal levels is what we want with your treatment. The main side effect when taking metformin is having low blood sugar. Symptoms of low blood sugar are sudden sweating, shaking, fast heartbeat, hunger, blurred vision, dizziness, tingling hands and feet. Low blood sugar is more likely if you drink large amounts of alcohol, engage in heavy or high intensity exercise, or take your metformin or other diabetic medication without eating enough calories in your food. So to avoid this, please eat regular meals and don't skip meals. Common side effects that patients experience with metformin are nausea and vomiting, upset stomach, diarrhea, weakness or metallic taste in their mouth. If you experience stomach symptoms from the first day of treatment, it may be a sign of lactic acidosis and you must contact your doctor immediately. In practice, I notice a lot of patients suffering with stomach and gastro issues while on metformin. Thankfully though, with the introduction of the slow-release metformin tablet and being coated, many of these patients suffering from these issues have been rectified. If you have any questions regarding metformin or any other medication you are using, please leave a message in the comment section below and I'll get back to them as soon as possible. If you enjoyed today's show, then please hit the like button and subscribe to the channel. Thank you guys for joining me. Take care. Goodbye.